Everybody know that during COVID-19 how hard the work and then the hospital situation could be. In your Twitter account, you were calling for PPE for your hospital. Can you tell us a little bit more about that issue? How's the PPE situation now?
Yes, I'd be happy to talk to you about that. So we're very fortunate. Early on in the pandemic, we came to realize that there was going to be a need for ongoing PPE supplies. So our hospital had a lot of foresight based on our previous epidemic back in 2003. So we had a lot of good pandemic planning. But I think the issue was that we didn't know how long that this current pandemic was going to continue. So thankfully to our wonderful community supporters, thankfully to the great work that our foundation does, we do currently have adequate PPE supplies, but we're still actively soliciting donations, again, mostly because we just don't know how long this is going to continue. Mm-hmm. But for now, we have enough. Our hospital is a safe place to get care. So I would encourage our community, if you need our services, don't be afraid to come. It is safe. If you need us to provide you with emergency care like we've always done, please don't be afraid to come to our emergency department.
Can you tell us a little bit more about your daily life as a ER doctor?
Well, I can probably speak for most of my emergency medicine colleagues across the country, where I can say it's really different now, where we have to think really carefully about everything that we do. So all of us, I think, when we all have some sort of a strategy or a protocol in terms of how we leave the house, and how we arrive at our workplace, and then how we conduct ourselves at our workplace. And then when we leave, I think we all have some sort of routine that we go through in terms of what we think is a safe way to leave the building, and then a safe way to arrive at home. I think a lot of us have done some different things. So I know of some colleagues that have sent their children away because they're so frightened of infecting their family. In particular, if their children are cared for by grandparents, I think most of us are absolutely terrified that our parents are going to get this. The initial data that came out of Wuhan was that it primarily affected older people, but we know now from our data in North America that this really touches on every age group. I really sympathize with those with school-age children. I think this must be such a difficult time. It's hard to explain to them what's going on. At least, my kids are they're all adults, and one is practically an adult, and so they have a great understanding. But even though they're big, they're still anxious. I know they don't tell me this a lot because they don't want me to worry about them worrying, but I know every time I go to work, they are so anxious, and every time I'm home, they're just very, very happy. So, this definitely impacts on kids of all ages. In terms of how we see patients in our emergency department, it's been really interesting. It's a moving target, constantly evolving. So it's been amazing to see how we incorporate new information and change our own processes. So probably like most people, we find comfort in routine. And change is hard, but we professionally have been forced to constantly reevaluate based on new data and then change accordingly. And again, I'm very lucky to work in a place where I think we've been quite responsive to new data. So, for example, if we're looking after patients who are very, very sick, before it was, well, I guess it's never a simple thing, but there were fewer things to think about. And now we have to think about lots of different aspects related to how do we make sure we keep our patients safe, how do we make sure we keep the rest of our department safe, and how do we make sure that we keep ourselves safe.
Mentally prepared, how I know because this is suddenly tons of patients could show up, and then their contingents or there's some other issues came up too because you're in ER room. So how extra mental preparation you had to do? You have to do everything.
That's a great question. I think for us at the very beginning, most of us were very anxious about dealing with this new entity that we had never encountered. Mm-hmm. So, whether we're new grads or whether we've been in practice for, quarter of a century, a lot of the things that we see are well defined and we've learned about. And for all of us suddenly to encounter this new disease that we have very little information about would understandably create a lot of anxiety. But what we have done, and what I think a lot of other departments have done, is that we've actually been actively practicing and preparing for these patients. So as a team, our entire emergency department, as well as we've had other departments come to participate as well. Like, for example, the Department of Anesthesia has participated. We've actually been simulating and practicing how to look after the sickest of these patients. And so since it started, we've now run, I believe, 16 simulation sessions to practice. And I know from feedback from my colleagues that it has really helped on multiple levels. But one of them has been to decrease their anxiety about the unknown. One of the scary things about never having seen something before is that you've never seen it before. But even if you practice it once, and then hopefully more than once, it brings you closer to the reality of what you need to do.
My last question, we have lots of audience, they are anxious too. So as a doctor, what's your advice to them at this moment?
At this time? Yeah. It's probably pretty similar to what the government has been saying. So, number one, be kind. I think everyone has had some sort of moment where they've behaved in a very different way from their usual because they're frightened. I myself had a moment like that very, very early. So, be kind and take some extra time to be patient. And then in terms of keeping yourself safe, it's the same information. Please stay home. If you need to go out to get your groceries, practice social distancing. All of these stores have got tapes, they've got dividers in terms of what aisles, what direction to walk down. So, thank you to them for being so organized about this. Thank you to the numerous organizations that has allowed the frontline healthcare providers to bypass the lines. So I've used that a couple of times and I've been exceedingly grateful for that. Wash your hands. Practice hand hygiene, absolutely. Certainly if you have medical conditions, if you have diabetes, for example, if you take medications that interfere or suppress your immune system, if you have heart disease, take extra care. If you have to make a decision in terms of should I take a chance and do something versus not, always choose the safer decision because it could really impact on your life very significantly.
Thank you for accepting me the interview and spend the time. And then it's very grateful to have doctors and then medical staff like you, and then we feel safe. And then thank you very much. That's the only thing.
You're so welcome, and thanks for giving me the opportunity to speak to you today and your audience.
Thank you.